How do breast self-exam guidelines work now? Imagine knowing your body so well that you can spot something unusual early on. That's the idea behind current breast self-exam guidelines. Instead of doing a formal, scheduled exam every month, women are encouraged to focus on breast awareness. This means becoming familiar with how your breasts normally look and feel so you can notice any changes that might need medical attention. Health authorities like the American Cancer Society and the United States Preventive Services Task Force no longer recommend routine breast self-exams as a screening tool. Large studies have shown that doing these exams regularly does not lower the risk of dying from breast cancer or help find cancers earlier enough to improve outcomes. Sometimes, routine self-exams can lead to unnecessary worries or medical procedures for benign lumps or normal changes. If you choose to perform a breast self-exam, it involves two main steps. First, visually inspecting your breasts in front of a mirror with your arms raised on your hips and then with arms hanging down. Look for any changes in shape, size, skin texture, or nipple appearance. Second, gently feeling your breasts using the pads of your fingers in a systematic pattern. Cover the entire breast and armpit area, applying light, medium, and firm pressure to feel for lumps or irregularities. It's best to do this a few days after your period ends when breasts are less tender. For women who are postmenopausal, choosing a consistent day each month works well. Timing is important. While routine self-exams are no longer recommended, if you do them, doing so once a month is typical. The key is to be familiar with your normal breast condition so you can quickly notice any new or unusual changes. Remember, breast self-exams are not a replacement for mammograms or clinical exams by healthcare providers. Mammography is still the main screening tool recommended starting at age 40 for women at average risk, usually every 1 to 2 years. It's also important to understand the limitations. Performing self-exams can sometimes lead to discovering benign lumps that turn out not to be cancer, which might cause unnecessary anxiety or medical visits. That's why healthcare providers now focus on personalized screening strategies based on your individual risk factors, such as family history or genetic predisposition. Talking with your healthcare provider about your personal risk and screening options is always a good idea. They can help you develop a plan that fits your health needs. In summary, today's guidelines emphasize being aware of your body and reporting any changes promptly rather than doing routine, structured self-exams. This approach helps catch potential issues early while reducing unnecessary worry and procedures. Remember, regular mammograms and professional exams remain the most effective tools for early detection and saving lives.